the season that I'm seeing that a lot in the office. So I want to give you some tips about what you can do at home when you need to bring your child in and when you can save yourself a trip to the doctor's office, the ER, or urgent care. Okay, so it's really common this time of the year for children to come down with cold symptoms or coughs, especially if they are in daycare, if they're around other children. So generally what will happen is your child will, develop a cough. If they actually have what we call a URI, an upper respiratory infection, they will have cough, runny nose, sneezing. They may or may not have a sore throat. And all of these things tend to resolve within like 2 weeks. So if your child starts off maybe coughing, then they get a fever for 2 or 3 days, runny nose, but they're okay. They're still able to eat, maybe decreased appetite. They're not complaining too much about their throat hurting. They probably just have a regular cold, okay? The things that you want to be concerned about is if your child has a history of asthma, and colds tend to trigger wheezing. If your child is wheezing and you can't control them with the meds that you should have been previously prescribed, if your child already has a diagnosis, if they are not being controlled, then that's when you have to take them in because they may need something more, like maybe steroids if they have asthma that's uncontrolled. If you have a very young child who's having any difficulty breathing, any respiratory distress, yes, you definitely want to take that child in. When you don't have to run in is because your child has had a fever for 2 days. That's okay, okay? That is, let me clarify that is if your child is over 2 to 3 months of age. If you have a child under 2 to 3 months of age, you always want to contact their healthcare provider. And even with all the things that I'm telling you today, when in doubt, contact your child's healthcare provider. A lot of times there's a nurse triage line that you can call, and they will instruct you as to whether you need to take your child in somewhere. So I think one of the biggest frustrations that I see with parents is that they will kind of push the panic button, run off to the ER or urgent care, spend hours waiting, and then someone says, "So, your child just has a viral infection and there's really nothing we can do." So I'm hoping that this will kind of save you from doing that, so that I can kind of tell you when you really should be worried. So it's common that your child might have a cough for generally it's at least 2 weeks, and it might even be 3 weeks, okay? But what happens in your average cold or upper respiratory infection is that over the course of the first week, your child's symptoms might get worse. So usually I see children in the office around day 4 or 5 because the parents were like, okay, I guess this is a cold. Oh, it's been 4 to 5 days. They're really not getting better yet. Well, you may not really see major improvement until the end of the first week. Okay, so once again, depending on the age of your child, if you have an older child who can really tell you if something is wrong, then you're pretty safe not to run in, after 3 to 4 days of cold symptoms. And once again, if you're in doubt, always call your healthcare provider and they will instruct you as to what you should do. Okay? Now, things that you can do to relieve some of the symptoms. For the cough itself, you have the over-the-counter cough medicines. They do not stop the cough, okay? If your child's coughing and your child is coughing up phlegm, we want that to come up. So what the cough syrups are doing is most of them have what's called an expectorant in them. So the expectorant is actually helping to break up the mucus so that your child can actually cough it up. So if your child's coughing and they've got phlegm, that's a good thing. We want that phlegm to come up. Now, another thing, and I know this can be kind of controversial, but I do believe that dairy products can increase mucus production in a lot of children. So if your child is having a hard time sleeping at night because, they just coughing out mucus, but you gave them a glass of milk or a bottle right before bedtime, that's probably not helping matters. So, I tell some parents, just humor me, stop the dairy products for like a week, see if they're getting better, see if the symptoms will go away maybe a little bit faster. Some of the home remedies you can do, you can use honey. Raw honey is actually good for a cough. The homeopathic cough medicines are safe for children over 1 year of age. So those are pretty good for coughs too. You have to be careful if you have younger children, because a lot of the over-the-counter meds are not safe for them if they're very young, like if they're 2-3 years old. Okay? Now, another thing that you can do is, and this one is really more along my truly holistic style of medicine, is that you as the parent or the caregiver have to remain calm and have to reinforce to the child that it's okay, they will get better. Because what happens sometimes is that as a parent or a caregiver, you kind of hover over the child. You're worrying about the child. Oh my gosh, you're not getting better. Oh, we may have to go to the doctor. We may have to go to the ER. Oh, woe is me, so to speak. And so that does not help the child, because the child picks up on your energy. So of course, as the parent or the caregiver, you're going to be concerned about your child. Oh, I see that somebody's here. Hi, I can't see who you are though. If you say something, I'll see. But as a parent or a caregiver, you're going to be concerned. That's your job. But, you just try to remain calm. Try to encourage your child. Let your child know that, everything's going to be okay, and then if everything's not okay, of course, you're going to go to the doctor, to the ER, or urgent care. But, just try to reinforce, try to be a positive reinforcement, for your child. And remember that at this time when you're sick, any of us, any of you are sick, your body needs rest. So if your child has a schedule that rivals yours, this is the time for them to maybe stay home and relax a bit. This is not the time to be in school. Right after school, they're going to sports practice, and then you're wondering why they're not getting better. They do need downtime. They do need time to rest. And even though they may only have a cold, they may still need to stay home from school for 1 or 2 days too, depending on when it kicks in. If it starts like on a Thursday or Friday and they can rest over the weekend, they're probably okay to go to school on Monday. But if it starts like on Monday, you may want to keep them out of school for at least 1 day. Let them get a day that they can really rest, that they can sleep in and restore their body, okay? This is very, very important, and I think this is something that we in this society do not do anymore. We want to keep on going, and we just want to take some medication to keep us going, and we do not take the time to just slow down. A lot of times, that's why we get sick. Our body is trying to tell us, you need to slow down. And it will give you little hints. So you don't want to miss the hints for your body or for your child's body. So if your child does have cough and cold symptoms, have them relax. It's time for rest and relaxation. Comforting foods, chicken noodle soup, healthy foods. This is not the time for sweets, because we want to stimulate their immune system to function well. So that's done best with wholesome foods, okay? So just a brief recap: if your child has cold, cough, or cold symptoms, generally it's not a major concern unless they have underlying respiratory problems. If they have a history of asthma, you want to make sure that this isn't going to trigger their asthma. Or if they do have any type of respiratory distress during these symptoms, you want to have them seen. Or any other, like if their ear is hurting or their throat is hurting, that's when you want to go on and call your healthcare provider, find out if you need to bring them in right now. Sometimes you're still told, wait 1 or 2 days. If it's not any better, then bring them in. But the worst thing you can do is rush out to ER or urgent care when it's not necessary. Now, mind you, I'm not telling you not to go. When in doubt, remember, always contact your healthcare provider, because we want to make sure that your child does get the proper care that they need. So that's it for today.